fifth presentation from Dwenase. And you guys are on.
Lauren, I think you might be muted. We can't hear you, Lauren.
Sorry about that. I was literally going this entire time. Hello, everyone. I was saying thank you for attending our project presentation today. We want to especially thank Kate and Chief Kwebna for coming to this presentation. We are going to talk to you about our consulting projects that we worked on with Friends of Dwenase and the Dwenase Health Center. Next slide, please. So this is our agenda for today. And this is the consulting team.
Hi, I'm Jumana.
My name is Lauren.
Hi, my name is Zoe.
Hi, I'm Kiki.
So Friends of Dwenase is an NGO committed to improving the quality of life for the people of Akyem Dwenase in Ghana, West Africa. As part of their 5-year strategic plan, FoD is working to improve the health outcomes and access to care in this region by starting to address the maternal and child health needs of the community. To accomplish this goal, the organization is focusing on addressing maternal and child health needs and digitizing the health records and pharmaceutical inventory of the health clinic. So we want to take a look at a bigger picture. Looking at Ghana, West Africa, it has a population of about 30 million people, with English being the official working language. The maternal mortality rate in the country is 310 deaths per 1,000 live births. And according to the demographic survey, 67% of those deaths are directly attributed to maternal causes, direct maternal causes, such as sepsis, hemorrhage, and other infections. Moving on to the Dwenase Health Center, which we worked with through this consulting project. It is located in the Fantiwa district region of Eastern Ghana. It has a population of about 30,000 people. It is a rural village. And so within this village, we have the Akyem Dwenase Health Center, and they provide services to this population of 30,000 people. They provide services such as labor and delivery, home visits, outreach, and screening. This is the clinic operations, their prenatal care and dispensaries, and the booklets you see on here are what the clinic is currently using to take in patients' health information. And Zoe is going to present on the next slide.
There are currently numerous problems that are preventing the clinic from reaching their goal. The clinic is currently using paper blue books to track MCH care. These blue books travel with the pregnant women throughout their pregnancies, from their home to the clinic and back again. This method of documentation can lead to human error. If, for example, the mother forgets to bring her blue book to the clinic for a prenatal appointment. In this scenario, because paper records are used, potentially life-saving information is not documented and therefore lost. An mHealth solution would allow for the clinic to be more efficient in tracking patients in their critical health information. The clinic is currently using paper tally cards to keep track of medication inventory. An mHealth solution would allow for the digitalization of stock and systematic processing. A lack of network infrastructure and limited cellular data in Akyem Dwenase limits the possible mHealth solutions. This information is critical in deciding how to address FoD's goals. Mobile solutions in rural Ghana are feasible for improving health outcomes. In 2016, Ghana implemented its first national EMR system, which was developed by the Ministry of Health to integrate with the National Health Insurance Scheme. Though the national EMR holds great potential for the country, its system requires a network infrastructure that is not currently available in rural communities such as Akyem Dwenase. Additionally, only 53% of cellular connections are 2G, and internet penetration has reached only 45% in Ghana, meaning a rural mHealth solution must function with limited cellular connection and network infrastructure. As previously mentioned, though the content of the Blue Books are philosophically robust, paper records can lead to human error. The digital solution translates the content of the Blue Books into an application that is both accessible to clinic personnel on a clinic tablet and functional with and without cellular connectivity. Similar to medical records, the clinic is using nationally approved tally cards to track drug inventory and medical supplies. Though fundamentally sound, these tally cards have the potential to be lost or misplaced, lead to restock errors, and restrict for the potential of scaling up. The digital solution that takes the content from the tally cards and translates it into an application that is accessible on clinic tablets and can track medication supply levels and dispensary activity.
The goal is to develop an application that clinic personnel will use to improve record keeping, supply chain management, and quality of patient care. For the maternal and child health e-records portion, there are 5 forms, 1 registration, and 4 follow-up. The follow-up forms include forms for prenatal visits, labor and delivery, postnatal care, and a referral form. The midwife and nurses will be the primary users of this portion of the application. However, unlike the nurses, the midwife will be the primary user of the referral form because she usually accompanies patients to the hospitals for their referrals. The drug supply e-management section is for drugs and non-drugs. Non-drugs include supplies like examination gloves and gauze. This portion consists of 4 forms, 1 registration and 3 follow-up. These forms will primarily be used by the dispensary assistant. In the registration form, the dispensary assistant will register the drug or supply. The second form tracks medications and supplies when shipments arrive at the clinic. The third tracks the movement of medications and supplies between the internal storage room, where drugs and supplies are stored, and the dispensary. Both of these rooms are in the clinic. The dispensing form tracks the drug being dispensed, how much is being dispensed, and the patient's information. The digital solution has several benefits for the clinic. With the digitization of these processes, there is much less potential for loss of data as compared to the paper forms and records that are currently being used. The easy-to-use format of ComCare allows for quick data entry and access to patient records, which will lead to more coordinated and efficient care. The ability of ComCare to collect data offline is beneficial in this situation because there's limited network connectivity at the clinic. One centralized location for all patient data allows for simple and more efficient data downloads that improve monitoring and evaluation. And easy data downloads allow clinic staff to measure and track health outcomes and drug use. The use of follow-up forms and case management also allows providers to track individual patients over time. Downloading the data from ComCare into Excel format facilitates data analysis for monitoring improvements in health outcomes and drug supply management. A main interest of the clinic is understanding how much medication is used per quarter. The chart on the left shows percentage of drug stock used by quarter for 3 different drugs. The right one shows drug stock wastage per quarter due to damage, loss, or expired drugs. These charts are an example of a dashboard for the drug supply portion of the application. And this information will be important for the clinic to keep better track of what medications that they're using the most and identify trends in drug dispensing and use.
And this is an example of a dashboard that could be generated from the maternal and child health data. The graph on the left is showing the percentage of deliveries that were premature or had complications, which are 2 of the main indicators for maternal mortality. And the graph on the right is showing the percentage of patients that missed their scheduled appointment. Tracking patient visits is something that was very important to the clinic, and as it allows for the midwife to follow up more closely with patients, track their referrals, new diagnoses and treatments, or to simply follow up with them if they have missed an appointment. To minimize risk of possible implementation challenges, we thought of a few potential ones and our recommendations for addressing them ahead of time. The first is lack of staff motivation to use the app and adopt new practices. And we encourage both the community and clinic leaders to voice their support for this app and its benefits, which will encourage the staff to use it. Another is a lack of time or materials for training. We recommend that the clinic schedules times for the trainings, and we have also developed training videos and a user manual in order to assist them. We're also going to be supporting the initial and primary app users through their training before they begin training the staff themselves. Another challenge is that the clinic currently only has 1 tablet that is shared with another department, so they don't always have access to it. And we are currently working with the team to get them more tablets. Sustainability of the application will be ensured through continually addressing stakeholder buy-in, timely application updates, continued tracking on app use and data analysis, and of course, access to tablets. Scale up is not something our client is currently considered or asking us to address, but we've realized how impactful an eventual scale up could be. And this is both in terms of expanding the app itself to include more than just the standard questions and potentially send patient text reminders for appointments or medication refills, or to potentially expand the app to other rural areas and clinics without access to the national EMR. And this would help eliminate potential confusion between patients and clinics that are still using patient records and allow for a simple, cohesive record-keeping system for those without access to the national EMR. And of course, this would also, more areas and clinics using it would also help ensure sustainability. That was a very short summary of our application. We are so grateful for the opportunity to work on this project and can't wait for implementation and to see the clinic's continual improvement of record keeping and the health of their patients. And again, we just want to thank Kate and Chief Kaboina for joining our presentation and all of the clinic staff who helped us answer millions of our questions throughout the semester that couldn't be on the call. And that is it. Does anyone have any questions?
I do. That was a really, really excellent presentation and great project. I wonder in your research if you found any other applications in Ghana that are used for maternal health and thinking about, potentially collaborating with other groups, just to ensure data sharing, or if there's other MCH applications that were already out there.
So in our research, we found that there's also, I know somebody asked a question if we've seen it in Nigeria. We read some articles that has been done in Nigeria, also in Kenya and different other African regions. And most of them tend to have similar settings in the sense that most of them are rural. So it's been working well so far. And we're hoping that the clinic can utilize the research that we found and go from there as we plan to work with them.
Yeah, awesome. I actually personally worked on a project in Nigeria on maternal child health. I could send you all of some evidence around that.
That would be awesome.
Yeah, that would be great.
That would be great.
Yeah,
Thank you so much.
Great work.
I did have one question just around the, I guess the child tracking. So within the application and maybe and in the screenshots that were available, it looked like it was all on the maternal health up through her prenatal visits and up through like that referral workflow. Were you guys responsible for building out any sort of child tracking as well after the birth? Or if not, how would the ComCare application, I guess, feed data into whatever other system that they are currently using for that?
Yeah, currently for the follow-up, all of the follow-up visits, we do have a whole section for each of the child that was born. So whether it's a previous child or the child from this current pregnancy, we are tracking all the data for the children as well.
And so to add on to that, it asks questions about the different vaccines that the child takes. So in postpartum, the postpartum form does that too, I believe. As Kiki said throughout the form, it does that. It asks from anything about growth and development through birth to 5 years. It follows the child through within our application. So we do track the child's movement from conception till 5 years.
Cool. And are those follow-ups just following that child? Would those visits rely on them still coming into the clinic, or would you be at all working with those midwives? Would they be going to the homes to continue to monitor either those mothers or those children, or would the majority of that data collection be done in the clinic itself?
It would be done both in the clinic and home visits. So it kind of just depends on the day. It sounds like most home visits happen in the morning, and then most clinic visits happen in the afternoon. So I think one of the reasons that they want to have this and that this is so important to them is so that Bernice, the midwife, is able to track women over time. And so therefore she knows, like if she hasn't seen someone in like a month or two, that she knows that she needs to go out and reach out to them. And that might imply going to them, which is why it's really important that this application works without networks, so that she can go and take the tablet with her, complete the visit, and then come back to the clinic and upload it.
Cool. Thank you.
Break in here in the interest of
I
time.
had one other.
And Kate, do you have any comments that you want to make or questions?
Hey, Wolfie. Yeah, I had a couple of quick questions, just mostly around kind of the functionality of the app itself. So my first big question was, you talked about the dashboards, and I know that those will be really useful to the clinic staff in the future. So my first question surrounding those is it set up using the data from the app to automatically refresh into that dashboard? Or is that I don't know if that's an automated process or if that's something that can be set up that is automated.
So the uploading of the data into the dashboard itself isn't automated, but we're in the process of creating the reports within ComCare so that those are updated automatically. And then the data can be downloaded in an Excel file and then uploaded to the dashboards to update the graphs.
Okay. Great. And then my second question on that was, is there a way in ComCare to set up, I guess, flags or reminders? So say, going back to your example of Bernice hasn't seen one of her patients in 3 months. But of course, she's the only midwife for all of these people. We know that she's always busy. Is there a way that ComCare can flag and say, hey, you haven't seen this patient, or you haven't followed up with this patient regarding this in this amount of time?
Right. So, there is an option to do that, but unfortunately, it's with the Pro version, which is a lot more expensive, and that's something that we want to discuss with you. So it is an option, but it is very expensive if you want to have that package.
That's perfectly fine. Thank you. I appreciate that.
Yeah.
Kwabena, did you have any questions? Where is he? He's somewhere. Oh, Kwabena, you're muted.
Oh, okay, sorry. I don't, but what I want to say is that I thank you all so much, for the hard work that you put into it, despite the challenges of having to deal with WhatsApp message, calling, gathering information, and the health challenges that is global that we are working, to deal with. And I can tell you that, those health workers in Dwenase are going to use the product very well. One good news was that yesterday the member of parliament for the district went there, and she realized that we hadn't finished the maternity building, so she made commitment, to make sure that that building will be completed. So we're hoping that she'll come through politically. So once again, thank you all. And Wolfie, thank you all. We gotta try to get you to Dwenase, Wolfie. This is your third student project for us.
Wolfie, you're muted.
Thank you, Kwabena. I'm about to go. And thank you for all your help over the last year and all the projects we've done together. When COVID's over, Ghana will be in my future. I think we should probably move on to our last presentation.